Valsalva described the maneuver in 1704 as forced expiration against closed mouth and nose. It was meant to expel exudates and foreign bodies from middle ear. Even now, ENT surgeons use variants of this. It was later that Weber described the cardiovascular, that is hemodynamic effects of Valsalva maneuver. Still later, the maneuver was standardized. Originally, it was mercury. Now it is aneroid. And the subject has to blow and maintain 40 millimeters of mercury pressure for 15 seconds. That's how it is standardized. So, it is not just training. It is a specific pressure is maintained. So it is easy to compare for research studies. Hemodynamic response to Valsalva maneuver can be better documented by invasive intra-arterial pressure recording. In the initial strain phase, there is rise in intra-arterial pressure, which is associated with reflex bradycardia. When the strain is sustained, there is a gradual fall in blood pressure, which is associated with reflex tachycardia. Soon after release, there is a dip in blood pressure, and which is followed by an overshoot. That is known as Valsalva overshoot. And Valsalva overshoot is associated with reflex bradycardia. If you do a Valsalva maneuver on yourself and continue to feel the pulse, you can easily make out this reflex bradycardia in the overshoot phase. That is phase 4. And there is something known as square wave response, classically seen in overloaded heart, as in heart failure. There are no 4 phases. This is the square wave response. With strain, blood pressure gets elevated and it remains so till the strain is released. There is no overshoot. That's because preload is high. Now, Valsalva maneuver has diagnostic and therapeutic uses. It can be used to differentiate murmur of aortic stenosis from hypertrophic obstructive cardiomyopathy. As left ventricular end diastolic volume decreases, aortic stenosis murmur decreases. In case of hypertrophic obstructive cardiomyopathy, when the end diastolic volume decreases, obstruction increases, causing an increase in murmur. That way, it can be used to differentiate between systolic murmur of aortic stenosis and hypertrophic obstructive cardiomyopathy. Then, therapeutic use is in termination of supraventricular tachycardia. Most of us are familiar with that. Valsalva maneuver can cause termination of supraventricular tachycardia. It can be used to assess the ECG in certain types of supraventricular tachycardia, like flutter, atrial flutter. If there is a Valsalva maneuver in increased vagal activity, in that situation, the flutter waves can become more prominent in between the QRS complexes. That's a way of differentiation. Then there is something known as Valsalva ratio, the ratio between the RR intervals when there is tachycardia and bradycardia. That can be taken from a monitor. In addition to Valsalva ratio, there is also something known as Valsalva delay, the delay to have the overshoot after the strain is released. Both these are used as indices of autonomic function. So, Valsalva maneuver has a role in assessment of cardiac autonomic function as well.